Dr. Travis Rose here from Peak Form Health Center, and we're here again with our patient that's dealing with some tension type headaches, and we've diagnosed that a lot of it's coming from his upper trapezius muscles. And when these muscles get overworked or they start developing trigger points in the muscle fibers, what they will do is they will start referring headache symptoms that come up along the neck, back of the head here, over the ear, and then settles down into the temple eyeball area. So a lot of times patients will complain that they're having a lot of symptoms around their eyes, say, oh, I have my headache that's right around my eye or deep to the eye socket, and it's stemming from these real tight muscles of the upper trapezius. So what we're going to demonstrate today is how to use Graston technique and some myofascial release into these muscle fibers to try to loosen up those areas and break down the muscle fibers to help handle the muscular aspect of these headaches. So before starting the treatment, what I do is I like to palpate the muscle, and I want to see where the most tension's coming from, where those knots or those painful spots in the muscle. So I'll just kind of palpate around the area, and there's a few spots I already feel, but kind of right in here, it's real tight and sore. And I don't know if you can catch this on the camera, but when I push into some of these spots, you can kind of see lines of those tight fibers going into their attachment points on either end here. So we know that that's an area we want to address. So I'm going to take the Graston tool here, and what we do is apply about moderate pressure, and we start working into these tissues. And Graston is excellent at promoting blood flow to chronically tight areas, and tight muscles don't have good blood supply, and that's often why they remain in this chronically strained or tightened, achy state. So we get mechanical breakdown with the tool here, and then we get a lot of blood flow to the area to bring in plenty of oxygen, other nutrients to the muscle fibers to allow the healing process to restart. So we're going to spend a couple minutes just working into these areas, checking in with the patient every now and then. Pressure okay, Nick? Mm-hmm. Okay. And we'll keep going until there's quite a bit of redness through the muscle there. That tells me that there's a lot of blood flow and the tissues are nice and warmed up. And then to just demonstrate another way that we'll do the Graston technique here, do it on this other side. Scoot to your left just a little bit, Nick. Okay, good. So now with the Graston technique too, you can have them do some movements here. So what we want to do is go ahead and look up towards the ceiling, and now I'm going to apply some pressure. Now go ahead and lower down towards your chest. So bring the head down towards your chest, and I'm just following the neck along as those fibers are elongating, applying some pressure and stretching those muscle fibers out. Look up towards the ceiling again, and then go ahead and go again. Down, down. Good. And one more time, look up. We're going to get the shoulder attachments of the upper trap here, so go ahead and go down, down. Good. So again, we're just working those tissues. I'm feeling for these tight spots with the tool. We'll feel some vibrations where there's a lot of fibrosis in the muscle tissue, and those are areas that we want to attack with the Graston tool. So now when we're doing the myofascial release, we want to work the tissues in different ranges of motion, and we try to have the best effect around the attachment points where this upper trap comes into the neck, and then also down to the shoulder here. So we're going to do a variety of movements to try to loosen up this area as best we can. So first one, what I'm going to have Nick do here is go and look up towards the ceiling again. And now I'm going to apply pressure, trying to find those tight spots into the muscle fiber. Now bring your head down towards your chest. There we go. And bring it back up. And go ahead and go. Good. So we're shortening the fibers. Go ahead and bring it back up. And then we're lengthening the fibers to try to break down those focal spots of tightness. Good. Back up. Let's do one more. And go. Okay, good. Now look straight. And then now just to hit the muscle from a different angle here, I'm actually going to use my forearm and elbow to get a little deeper into these tighter spots that are causing some of the tension headaches. So go ahead and tilt your head towards my arm now. So we're shortening those upper trap fibers, and now bend your head away from my elbow. And I'm just applying some deep pressure into these muscles here. This is a move I have to use on some of the more muscular guys that come into the office, or guys and gals, so we can get enough pressure into those real deep spots in the upper trap. You doing okay with the pressure?
Yeah.
Okay. Good. Let's do one more and go. Okay, good. And then the last one I like to do for the upper traps and getting into these painful spots in the upper trap here is we're going to do some rotational movements. Now, just a quick check. Nick, go ahead and turn and look over your left shoulder like you're checking traffic. And then turn, look over the right shoulder. And one more time to the left. Okay, actually it looks like he does turn a little bit better to the right side here, and it might be because we already loosened up the right upper trap pretty well. But what we'll do now is we're going to have him actually rotate to the right, and I'm going to apply some pressure into this upper trap, and now go ahead and rotate all the way to the left. So again, we shorten the fibers, now we're lengthening it into rotation, and this is an important muscle to loosen up when a patient is having a hard time turning, looking over their shoulder. Go ahead and go. Oh yeah, doing okay?
Yeah.
Hanging in there?
Yeah.
And go ahead and go. Let's just do one more. There we go. Good, 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 good. Okay, now turn to your right again. Now turn all the way to the left. That looks pretty good. How does that feel compared to the first time?
It feels like it was a big difference.
Yeah, looks like it. Okay, so that's how we handle the muscle tension of the upper traps, and that helps a lot with those tension type headaches, and can also help with some of the neck pain that patients will get, especially if they can't turn their head all the way to one side or the other.